Now, you talk about is there a timeline? I mean, obviously everybody is going to be different. You know, if you're almost, well, let's start here. Say you're almost completely bald, or you have definitely like a bald spot. Is there potential to regrow that completely, or can you not regrow it completely?
Well, that's a very good question, because for us, the realistic expectations is the key. Happy customers come from giving people realistic expectations. So a bald guy is not going to get a full head of hair. As we were talking about before, the lasers are 90 to 100% successful, but it's not 100% to regrow everything you want. That's part of the reason we use the multi-therapeutic approach. So anybody who has small, thin hairs have a very good chance to make those hairs fuller and thicker again. And hairs that are dormant are not producing. So like you said, if you have a bald spot, you may be able to bring that in. If you have little thin hairs, you may be able to make and cover that back up completely. But everybody's individual, so that's one of the reasons that we do a full medical consultation with people. We look at their family history. We look at any drugs they're on, any diseases they have, thyroid, anemia. There's a tremendous amount of things that affect them. And one of the things that happens is women, and this is something most people don't, 50% of all women by middle age will have thinning hair. Women are over 50%. They're more like 70% of our clients. A lot of women have hair loss, but they're very good at hiding it. So it's very devastating. As men, you see guys, Sean Connery was voted the sexiest guy, and he has no hair. But for women, it's very devastating. So a lot of our clients are women, and they have the opportunity to get that hair back, and it really makes them happy. The change that you see somebody in their confidence when they've regrown their hair, it makes you feel good. It really does.
All right. We're going to come back in just a minute with William Blatter and talk about hair loss and hair regrowth. So stay with us. Welcome back. We're back with Bill Blatter talking about hair loss and hair regrowth. He's the president and CEO of the Hair Loss Control Clinic. Before we went to the break, we were talking about, I'd asked you about, whether, sort of how far you can go with people. You said mainly if you've got fine hair, you can probably get a lot back. If you've got a bald spot, it can grow in a little bit. At what point along, I guess, on the spectrum do you see most people come in? Are you seeing people when they've gotten to the point where there's a bald spot, or are more of them at the point where they're noticing that there's a thinning or a loss?
It's all along the spectrum. And the key, as I was saying, is realistic expectations. If we have somebody come in there and they've lost most of their hair, and they want to regrow their hair, we're going to send them to a hair replacement center who can give them a hair piece, okay? And again, if those are done right, they can look very good. And we work with hair replacement centers all around the world to do that. And a lot of them bring in the laser because they have people that come in that aren't quite ready for it. There's other people that can regrow some hair, but they also want a hair transplant. They want to take that hair from back here and transplant it up forward. And that can be great too. So we work with a lot of hair transplant doctors that we can refer people to too. We work with a Dr. Hagstrom, and it was kind of amazing. She has a practice up in Minnesota, and she's using some of the most innovative techniques that are available today. It's actually automated transplant, one hair at a time. And she's done some amazing things. But she's used our laser incorporated with that, and she's actually said now, and it was actually quoted in the National Hair Journal, kind of the Journal of Hair Loss, that she's had 100% success. Everybody that she's put on our program with laser has regrown hair. She actually had a person recently who came in for a hair transplant. He was 27. He had thinned at his temples. He came in. She put him on treatment for 4 months before she went to do the transplant. He came in the day of transplant. She said, I don't need to do a transplant on you. You've regrown enough hair. So it comes down to what the individual needs, but we see all types of people, all spectrums.
Is there a, and I may have asked you this, but again, I mean, is there sort of a ballpark as to maybe how long it might take for this to work? Obviously, everybody's going to be different based on how much loss they have or how much they need to regrow.
Yeah, that's true, and that's one of the things with realistic expectations. Again, we're an instant society, microwave society today, but your hair grows slow, a quarter to a half an inch a month. So typically, most people will stop their hair loss in the first month or two, and somewhere in month 2 or 3, they'll start to see it, but they may not see it in the mirror. We use something called a capilloscope that magnifies the hair 50 and 200 times. So we can show them those hairs that are starting to regrow before they'll see it in the mirror. And it's amazing. We'll have people come in at month 2 or month 3 and say, geez, I don't know if this is working. we put the scope on them, and they see all the new little hairs regrowing, and they're just thrilled about it, and their perspective changes totally. So most people will start to see that growth there, and somewhere between 3 to 6 months they'll see it in the mirror, and somewhere between a year and 2 years they'll have their maximum regrowth that they're going to get. That's realistic for most people.
So this is really a long-term thing, and obviously it involves follow-up. I mean, I guess when you're done, you may not really be done.
Well, it's like anything. Are you going to shampoo your hair forever? Yes, you are, or it's going to get dirty. Are you going to work out? Yes. So you're going to need to do something, and you'll get that benefit for as long as you do that. So basically, it's a lot easier to get your hair back into that growth cycle, or harder to get into the growth cycle, but it's easier to maintain it. So it's kind of like building muscle. It takes a lot more to build your muscle than it does to maintain it. That's kind of the way hair loss works.
You know, you talked earlier, too, about the idea of, you know, you hear these things, you know, the late-night infomercials, buy this, get it free, order now, you'll get extra, and your hair's you're going to have, like, a gigantic full head of hair. I'm sure there's probably a natural amount of skepticism to think that, you know, people think once it's gone, you know, it can't be grown back. What makes what you do different than what maybe these other products that tout that they work? What makes yours work where theirs doesn't?
Well, first of all, it's not one thing. You need to take a multi-therapeutic approach. And again, we've done this for many years. We have doctors that come from all over the world to see us to learn how to do it. So the transplant doctors from Sweden and Australia are coming here to learn from us. And part of it is being realistic and taking the best, as I was saying, for each thing. It's easy to say, buy this pill, it's going to regrow everything. It's a lot harder to explain that you need to do this and do this and do this. But that's what's real, that's what works. And what we found is if you take the time to look at the person's individual needs, care about them, and do what they really is in their best interest, that's where you get long-term clients. And that's how you'll succeed, by taking the best lasers, the best products together and giving people real help, and also the checkups. We do checkups on a monthly basis with people, so we can vary their treatment. So they may start off with laser and a natural product, and then they move to a minoxidil-based product. We actually have double and triple strength minoxidil by prescription through our doctors. So it's based on their needs. So if they're not getting everything they need at month 3 or month 6, we can upgrade them to a stronger program, more laser, other products. That's part of it too. It's not a one-size-fit-all. It's kind of like when someone comes in and says, "Doc, my knee's hurting me." Well, what's it going to take to do it? Well, until we look at you, the doctor can't say, "I'm going to shoot you with cortisone, I'm going to give you an aspirin or a knee transplant."
So it's not like, so some of these things that may say you could do it, essentially somebody throws it at you and say, "Here, take it," and you'll find out. But what you're doing is sort of looking at the underlying situation, seeing what to do, and then kind of going from there.
Absolutely. Sometimes thyroid, anemia, hormonal issues are part of it. So we try to take a look at the whole person, their whole situation, and put a program together that's going to work for them based on their individual needs. And that's really the key. We have programs that are different for women than they are for men. We're going to treat an 18-year-old different than we are a 70-year-old. But I can tell you we have some 70-year-olds and 70-plus-year-old people that are thrilled with their hair that they got back. And the funny thing is, a lot of them are skeptical up front, and after they do it, then they want to tell people. That's the interesting thing. People don't want to talk about it unless they're successful. Once they are, then they're happy to talk about it.
All right, we're going to take another break, and we're going to come back and wrap things up here. So stay with us.